In fact, each of those subjects is a very, it has a lot of material in that, so I don't think I can do justice to all those subjects in details. My emphasis will be only on an overview. So just give you an idea of what is medical astrology. And if you know astrology already, then this will be too elementary for you. If you don't know anything, that will be great, and then I'll be able to tell you about something, about this astrology. But medical astrology, you see, in the classics, there is no separate branch of medical astrology. In the classics, we get muhurta, we have, mundane astrology and other things, Varshfal and so on. But medical astrology, separate subject, there is none. So what we have done is that we have picked up standard principles from astrology, we have organized them, and then we have managed to use them in the medical cases. And this is the definition. That branch of astrology which deals with an understanding of disease and its various aspects. So, all that. Obviously, if you want to do medical astrology, you have to know astrology quite well. And if you know medicine also, that is a great help. Now, Ayurveda says that the body and the mind are the abodes of disease. Although, the WHO definition is slightly different and more elaborate, but we will consider that the body and the mind are the sites where the disease occurs. And that is the area that medical astrology will cover. It covers the physical and mental aspects of disease. As I told you, it is not a defined subject in the classics, astrological classics. And we have actually, taken up standard principles, and we are applying that to the medicine area. If you read the classics, they will give you very, random and vague combinations about disease. You see, for example, leprosy. Leprosy, we know as medical people, is an infection. But if you read the Ayurvedic texts and also the astrological texts which give you combinations about leprosy, then they call it Kusht Rog. And there are many types of Kusht Rog, white Kusht and black Kusht and Rakt Kusht and so on. But they basically consider Kusht as something which is a disease of the skin, which is a chronic disease, which defies simple treatment, and something which is chronic and long-standing and troubles the patient. For us, in medical sciences, it's an infection by a bacteria which is treatable by antibiotics. So we have to use these old classics judiciously and derive our own meanings, and then also study a lot of cases to apply those principles properly. Available combinations in the classics not coherent enough for accurate diagnosis. So if you read the classics, they will not give you sufficient material to diagnose a disease properly if you are reading the astrological classics. So they will give you some hints, and they also use the Ayurvedic terms. No allopathic terms, so obviously we have to derive our own meanings from there. So that is a difficult task. So that is why it's very important that people who are experts in astrology and the people who know medicine, they should join together. And that is also why the doctors should study astrology, because if they study astrology, then they can understand things better. I will take you to the scope of medical astrology. Now, medical astrology covers almost all areas of health if you apply it properly. One is that you should be able to identify a chart which is prone to illness or which is indicative of good health. Because if you have a chart where sound health is indicated, then simple problems here and there, they don't trouble you. You know about the present epidemic. It doesn't, everybody is exposed probably, but everybody responds differently to the same infection under same circumstances. So if the horoscope has some strength in it, then you will not suffer ill health easily. And if you have a horoscope which shows you proneness to illness, then small variations in the movement of planets will also cause illness. So this is the first thing that you need to study in a medical astrology chart. The other strong area of astrologer, and compared to the physician, is the time of onset of disease, which you can identify, which you can detect by astrology, which you cannot detect by your medical knowledge. You can't for example, predict that somebody is going to have an appendicitis after 2 weeks. But if you are adept in astrology, you would probably be able to see that there is a likelihood of disease, and if you are able to diagnose it, that is great. If you can't, even then you can indicate that there is a possibility of disease. And this is an area which is very strong as far as Vedic astrology is concerned, because we have a very elaborate system of understanding of the horoscope and then application of the techniques which help us time the events. The two techniques that we use are the dasha and gochar. Dasha is the planet's operational period, and adverse planetary period will be adverse for health. And gochar is the transits. The planets keep moving. So your horoscope is a chart of the fixed position of planets at the time of birth, but the planets keep on moving, and that is called gochar. So this movement of planets keeps activating different areas of your horoscope, and therefore causing different events during your life. So in this case, I would think that an astrologer is better off than a medical man. The next important area is the nature of illness. Obviously, if you are predicting something adverse for somebody, then the next question is what is going to happen. And this area is a difficult area for astrologers because not enough work has been done on this area. As I told you earlier, the astrological classics do not give you adequate information, and you need to do a lot of research in this particular area. And a medical man has lots of means at his disposal, so many investigations. Even a simple stone, you have x-rays, you have IUPs, you have CT scans and so on. And in astrology, we have different methods, we have different techniques, but then we have not applied them on known horoscopes, and so we don't have ready formulae for diagnosing a particular illness. So this is an area which needs to be developed by the astrologers, and if it is a medical astrologer, that will be a much better option. Then once the disease has occurred, the course of illness is another area, which means the outcome, and this is again generally decided on the basis of the dashas and gochar, how the planets are operating and how the planets are moving and what is the dasha operating at a particular time. So obviously, as the planets move, the condition of the patient varies, and this is an area which astrologers are quite adept at, and I think the doctor and the astrologer should be almost on the same level as far as the likely outcome of a disease is concerned. Astrologically, you can find out the complications arising during the course of illness or during its treatment. You can also think about the best method of treatment: conservative, surgical, palliative, astrological. And we strongly advocate that you do not prescribe the astrological remedies exclusively, only in preference to other treatments, because if you have any standard well-established scientific treatment available for an illness, then astrological treatment should not be a substitute for that. So this can be an addition, this can be a complementary thing, but certainly not an alternative. And then you can also understand the residual effects of disease or its treatment astrologically. Then determination of longevity. That is a difficult area, but then it's an important area because this also, I normally like that I don't predict the longevity of anybody, but it is a good area for our own research because that makes us understand quite a lot of astrological principles. So I think this is an area, certainly not for predictions, but for your own study. Nature of death can be determined. Astrology and genetics is an important area, and the moon is considered to be the seed. So it is seed even for the crops also, and seed for the human being also. So you will find that, horoscopes of parents and children or horoscopes of siblings, they have a lot of things which are common, and particularly the moon in the related horoscopes is placed in some key areas, which indicates that there is a link between the parent and the child and between the siblings. And of course, the astrological and astromedical remedies. Remedies are, of course, astrological remedies are important. They must be effective also. I'm not very sure about it. But since we follow the dictates of the rishis, and the rishis have given us certain astrological remedies. So if the rest of astrology is correct, then the remedies prescribed by them must also be correct. But this is an area which needs to be studied, and I think if it is found effective, it is very good to utilize it because it doesn't hurt anybody. And I have mentioned there, astrological remedies do not negate the relevance of standard, well-established, scientifically proved, generally allopathic treatment. Generally allopathic because that is the most common treatment available around. And if you have any other treatment alternative to allopathy, that is also fine. But certainly the astrological remedies should not be the alternative for standard scientific treatment. Then what should we do? A deeper study of Vedic astrology, obviously. Better understanding of astrological classics. At least an elementary understanding of disease and its pathogenesis for those who are not doctors. Scientific application of astrological principles to charts of patients with known elements. Because we see, if we have to study a subject, we have to study it scientifically. And we have to proceed from the known area to the lesser known area to the unknown area. So we have to start from the charts of patients with known ailments and drawing inferences and conclusions without violating the classical principles. I am very, strictly following the Parashari principles, sage Parashar, and we are doing this Parashari astrology. So certainly no violation of the basic standard principles of astrology, but then we can be liberal with the principles and we can use them in the modern day context. Application of knowledge so gained to charts of patients with unknown ailments. Perpetual refinement of techniques. That is also important, and most of us use very little of the techniques which are available astrologically, but we have plenty of techniques and we can do a lot of research in those areas. Mutual sharing of data and findings. This is something which the medical science people have done, which the astrologers have not. Our astrologers normally do not share their data, but it is very important for the growth of the science to share the data and the findings and then discuss things. Recourse to and refinement of lesser used, subtler techniques of Vedic astrology. Constant touch with the medical profession to remain aware of medical progress, because medical progress is going on and we have to continue having that knowledge to use in astrology. Now, this is something, if you are an astrologer already, this is not for you, but it is for those who are not astrologers. The important elements of astrology are the 12 signs, Rashis as we call them, Most of you know the names, even if you are not an astrologer, because you know these, columns, astrological columns in the newspapers, and you know about the signs. So there are 12 signs of the zodiac. Astronomical disposition of the 9 grahas or planets, we call them, in English we call them planets, although all of them are not planets. But the right term is the graha, which means that graha is to hold something up. So these grahas you see in the zodiac against the background of the stars, which are far, far away. And it appears as if this graha is moving and catching hold of another group of stars, and then like that. So that is why the term graha is used. And then when the dasha of a graha operates, it is as if this planet or graha has taken hold of you, taken control of you. So that is why this term graha. But for convenience we use the term planets. And we have 9 of them. We don't normally use the extra certain 9 planets. 9 planets that we use are the Sun, the Moon, Mars, Mercury, Jupiter, Venus, Saturn, Rahu and Ketu. Rahu and Ketu don't have a physical body. They are mathematical points, but they also move along the zodiac in the reverse direction. So they always have a retrograde direction. And these 9 planets and the 12 rashis, their interaction is what gives you most of the understanding of the individual from the horoscope. And then this zodiac, which is divided in 12 rashis, the same zodiac of 360 degrees is divided into 27 nakshatras or star clusters. So if you look in the sky and if you look at the path of the sun, so along the path of the sun, which we call as the ecliptic, just as imaginary band about 9 degrees on either side of it, it's a total 18-degree width. That band around the whole Earth, that is the zodiac, and these planets don't stray away here and there, they stay within the limits of the zodiac. And on that zodiac, we have divided that zodiac into 27 parts, and that is the 27 nakshatras, which are also very important. And this zodiac, because the Earth rotates once in 24 hours, so this whole zodiac or the 12 rashis or the 27 nakshatras, they appear as if they are moving around the Earth once in 24 hours. So whatever sign or rashi is rising on the eastern horizon, that sign is important, and that sign is called as the lagna or the ascendant. That is the first house of the horoscope. And this sign rising at the eastern horizon at a given moment, that is also important. So that is why the time of birth of an individual, because that gives you the rising sign or the ascendant. And that is most important, because all these grahas, they are subservient to the lagna. This lagna or ascendant, they become good or bad according to the lagna. So it is very important to record the time properly for a particular place. So we get the date, time and place of birth as the important particulars for a horoscope. So time because the exact sign or rashi will be rising on the eastern horizon, and place because for different places, you know that sun rises in the east earlier, in the west later. So whatever sign is rising at that time and at that place, that is important. Lagna is the first house, and from that first house we count the other 12 houses. So 12 rashis are different and the 12 houses are different. The rashis are the 12 signs, starting from the first sign, which is Aries or Mesh, and the lagna is the first house of the horoscope. Any sign could be the first house. So that distinction we need to have. Horoscope is the charting of the astronomical position of grahas and nakshatras with lagna as the starting point. So lagna is the first point, and then other signs in different houses. And of course, those who are into astrology, they would know that Vargas, Vargas are subtle deviants of the horoscope. Those who are into astrology, they know that The basic chart is too basic, so therefore you need to go into subtler divisions of the horoscope, because you see there are 12 signs which rise and set in 24 hours. So an average of 2 hours for a sign. So any birth that will take place within any 2 hour segment would have the same lagna. But if you have the accurate time and the accurate degree of the sign which is rising at the horizon, then you go into the subtle divisions or vargas, and that differentiates people who are born closer in time. So this is very important. And use of several upagrahas or subplanets are also that's also a special area of astrology which we have not used adequately for routine predictions. But I think this is an area which will be very important as far as the medical astrology is concerned. And then, of course, we have an elaborate mechanism to time the events using the dashas and the transits. Now, planets rule over the rashis. So, planets are there, rashis are there, and the planets own the rashis. They lord over the rashis. And that way, I'll show you a diagram now that will show you how different planets rule over different signs. Different rashis fall in different houses of the horoscope depending on the rashi in the lagna or first house. So, for example, the fifth rashi falls in the lagna. So, sixth rashi will be the second house, and then seventh rashi will be the third house, and so on. Then, so the planets, because they rule over the rashis, they will be ruling over the houses also. And in general, some houses are good, some houses are bad. And I am not going to go into the details because that will take a lot of time. But just to give you a simple idea that houses 6, 8 and 12 of the horoscope are considered to be bad for health, 6, 8 and 12. And their lords, the lords of those houses are adverse. The planets which are located in those houses, they also give you trouble as far as your health is concerned. And the houses 1, 5, 9 are among the best houses of the chart. They are generally considered to be good. So this is just about the general thing about the houses. If you look at this figure, you look at the sun and the moon. So sun owns Leo or Simha, and moon owns Kark. And then closest to the sun is the Mercury, which owns the two signs around it. Kark is the fourth sign, and Simha is the fifth sign. So around it, 6 and 3. These are owned by Mercury or Buddha. Then Venus is further away. It owns Vrishab and Tula, which is the second and the seventh. Mars, the first and the eighth. Mesh or Aries and Scorpio or Vrishchik. Then outside that will be Jupiter, 9 and 12. This 9 is Sagittarius, 12 is Pisces. And Saturn, the remaining two. Saturn is the farthest, so that will be Makar and Kumbh, Capricorn and Aquarius. So this is how the planets, they rule over the different signs, and this is a simple diagram to understand, because if you keep sun and moon, the two luminaries in the middle, then around it the next planet is Mercury, next is Venus, next is Mars, next to that is Jupiter, and the last one is Saturn. And sun and moon own only one sign each, while all these others, they own two signs each. So this is how the different planets, they own the 12 rashis or the 12 signs. And then, okay, this is a shloka from Gita, and you have heard it many times. You might wonder why I have put it here. This is from chapter 4 and shlokas 7 and 8. Gita. It says, Yada yada hi dharmasya glanir bhavati bharata abhyutthanam dharmasya tadatmanam srijamyaham paritranaya sadhunam vinashaya dushkritam dharma sansthapanarthaya sambhavami yuge yuge. It is and of course you understand the translation also. Whenever dharma or righteousness suffers decline and adharma or unrighteousness gains ascendance, it is then that I manifest myself in order to rescue the noble, to destroy the wicked, and to establish dharma again. I manifest myself from time to time. Now this is what God does. What God does is that He protects your dharma and He punishes if you are into adharma. So the same principle is applicable to medical astrology. Our planets are gods, and if you follow the dharma of health, they will support you. If you don't follow the principle of health, that is your adharma, and these planets will only punish you. So it is these planets, that is why we worship them also, we propitiate them also, because we consider them as gods. We consider Sun as God also, we consider Rahu, Ketu and Shani also as gods. So if they are adverse, they punish us. And to keep them pleased, we obviously propitiate them from time to time. And for that, of course, various methods are available. We are not going into that remedial astrology part. But the same principle